Nationally, as of just a few minutes ago, 2,793 cases with 12 deaths. Those people that have died, there's been several over the last 24 hours, very sadly, and my best wishes go out to the families of those people, of course. The majority of those deaths remain in older people, although there was a person died overnight who was in their 60s. So this is showing that why we are taking this situation seriously and have done so since the beginning. I just wanted to talk about the issue that we're finding with testing. So we have, as we announced yesterday, increased our testing width, so we're testing more people, more categories of people, but also many more tests. The testing that is available in every state has been expanded over the last few weeks, and now we have tested over 178,000 tests have been done in Australia. About 10,000 a day now is our capacity, and everyone is testing both in the public system and the private system, so there are many possibilities of getting tests. There are new tests that have come on the market, and I just want to really address that. We are not at the stage of people being able to do their own tests at home, in a so-called point-of-care test or a rapid test, although there are rapid tests that will be coming into Australia. Indeed, some have already arrived and are undergoing the very important quality, safety and efficacy testing that our Therapeutic Goods Administration does. We are really ramping that up to make it as quick as possible. Several of these tests were rapidly put through that regulatory component over the weekend. But it's very important that we have tests that work and are reliable, and they are the ones that people should be having, and they will have them if they go through the system that has been set up. But 178,000 tests, that's a lot. It's probably more on a per population basis than virtually anywhere else in the world. It is, for example, over 25 times as many on a per capita basis as has happened in the US. In the US at the moment, 53% of those tests are positive, which demonstrates that they have a long way to go to have enough testing being done in the United States. Here our positivity rate is just under 2% now, 1.5%, and that again demonstrates, firstly, that we're doing a lot. Secondly, it convinces me that we're finding the ones that we need to look for. In terms of other things we are ramping up our healthcare worker engagement, and so my colleague Professor Michael Kidd ran a webinar today, and we're committed to doing that every week, at least once a week. There were 14,000 healthcare workers on that webinar. It demonstrates that people are keen for information, but also that there is an opportunity for people to ask questions to be answered by Michael, and that's just one of the ways we're getting that information out from the Department of Health. We are continuing to scour the world for the things that have been talked about over many days, ventilators to put into our intensive care. We are expanding. We're in the midst of expanding our intensive care capacity right now, but including looking to purchase more ventilators both here in Australia and elsewhere. Similarly with personal protective equipment, there has been issues with that over the past few weeks, as has been talked about a lot, but we are increasing our capacity to make masks in Australia, looking for ways that we can increase our capacity in our national stockpile, and then to push out into the frontline services that need these things as soon as possible, and indeed we're doing that right now. We're looking very closely and carefully with the colleges, the medical colleges and other societies, as well as our nurses and midwifery and our allied health workforce, at models of care which can work not only for safety of those staff, but also to give the right care at the right time to everyone that needs it in relation to not only COVID-19, but to all of the other health issues that we continue to face. I just want to make one more absolute key point about what are we trying to achieve here. We're trying to achieve the flattening of the curve, which means having less cases if possible, but certainly having that rise in cases to decrease over the coming weeks. And as we do that, what are the key principles? Social isolation, keeping people apart as much as possible. When you are in situations where there are other people, keeping your distance from those people. And most importantly, if you are sick, stay at home. If you are sick with the symptoms of COVID-19, particularly if you are in the higher risk groups, so that's return travellers, people from age in healthcare professions, people that have been in contact with a known case of COVID-19. And people with pneumonia, which is seems to have no other reason for having that diagnosis. These are the very important areas that should be tested as soon as possible. Stay at home and isolate from others to protect others. This is in our hands. We need to wash our hands, is the other message, of course, but the whole thing is in our hands as a society. We need to take these things seriously, and those messages for return travellers, for those that are sick, those that have been recognised as contacts of people that have COVID-19, we need to stay at home and isolate ourselves from others.